Septic shock, things you should know, questions and answers, Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Septic Shock, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of septic shock. Chapter 1. 1. What is septic shock? Septic shock is an infection that causes blood pressure to drop to very low levels, causing organ failure. 2. Is septic shock life-threatening? Yes, septic shock is life-threatening. 3. What is sepsis? Sepsis is a life-threatening condition in response to an infection. 4. Can bacteria cause septic shock? Yes, bacteria can cause septic shock. 5. Can fungi cause septic shock? Yes, fungi can cause septic shock. 6. Can virus cause septic shock? Yes, virus can cause septic shock. 7. Can septic shock affect any part of the body? Yes, septic shock can affect any part of the body. 8. Is nausea a sign and symptom of septic shock? Yes, nausea is a sign and symptom of septic shock. 9. Is vomiting a sign and symptom of septic shock? Yes, vomiting is a sign and symptom of septic shock. 10. Is pale skin a sign and symptom of septic shock? Yes, pale skin is a sign and symptom of septic shock. Chapter 2. 1. Is cold skin a sign and symptom of septic shock? Yes, cold skin is a sign and symptom of septic shock. 2. Is nausea a sign and symptom of septic shock? Yes, nausea is a sign and symptom of septic shock. 3. Is hypotension a sign and symptom of septic shock? Yes, hypotension is a sign and symptom of septic shock. 4. What is hypotension? Hypotension is a low blood pressure. 5. What is the optimal blood pressure? The optimal blood pressure is 120/80ths of a millimeter of mercury. 6. What are the values for hypotension? Normally, the values for hypotension is anything less or equal to 90/60ths of a millimeter of mercury. 7. Is confusion a sign and symptom of septic shock? Yes, confusion is a sign and symptom of septic shock. 8. Is diarrhea a sign and symptom of septic shock? Yes, diarrhea is a sign and symptom of septic shock. 9. Are palpitations a signs and symptoms of septic shock? Yes, palpitations are signs and symptoms of septic shock. 10. Is shortness of breath a sign and symptom of septic shock? Yes, shortness of breath is a sign and symptom of septic shock. Chapter 3. 1. What are the complications of septic shock? The complications of septic shock include heart failure, respiratory failure, kidney failure, gangrene, and even death. 2. What is gangrene? Gangrene is the tissue death caused by a lack of blood supply. 3. What is heart failure? Heart failure is when the heart cannot function properly and pump blood effectively. 4. Is organ failure always permanent? No, organ failure is not always permanent. 5. Can septic shock cause blood clots? Yes, septic shock can cause blood clots. 6. What are the treatment options for septic shock? The treatment options for septic shock are intravenous fluids, oxygen therapy, antibiotics, mechanical ventilation, sedatives, dialysis, etc. 7. What are antibiotics? Antibiotics are medications that fight against bacterial infections. 8. What are inotropic medications? Inotropic medications are medications that modify the contraction of the heart. 9. What are vasopressors? Vasopressors are medications that constrict blood vessels. 10. Give examples of vasopressors. Examples of vasopressors include adrenaline, dopamine, and noradrenaline. Chapter 4. 1. What are sedatives? Sedatives are depressants of the central nervous system. 2. What is dialysis? Dialysis is a device that replaces the function of a damaged kidney. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding septic shock.